Hello, I'm Lucy Norton. I'm a partner in the Clinical Negligence Department at RWK Goodman Solicitors, and today I'm going to talk to you about acquired brain injury. An acquired brain injury simply is an injury to the brain that's occurred after birth. This can be in the form of strokes or brain tumours, it could be surgery or traumatic, it could also be caused by infections such as meningitis or encephalitis, or sometimes through hypoxia, which is lack of oxygen to the brain. The consequences for having a brain injury are significant for each individual. They can be physical, such as lack of mobility or problems with speech. They can also be cognitive, such as behavioural issues, change of personality, and also fatigue. Disability from a brain injury are quite often hidden because someone can look completely uninjured on the outside, but inside are masking quite complex deficits that they're now having to overcome. The reason for bringing a claim for brain injury is that it's the one organ that can't be fixed. It can't be repaired or put back how it was. Therefore, it's going to affect somebody for life. The physical problems or cognitive problems may be ongoing, and whilst they can improve, they might not be able to carry on as they once were. Life is never going to be the same again. The law is there to protect individuals who've been injured and is to put them back in the position they would have been but for the negligent acts or omissions. In reality, compensation is going to provide people with the money to help their recovery and aid their rehabilitation through life. With compensation, the injured person becomes the author of their future. They can obtain the aids and equipment they need, get the care they require, and have therapies at the time that is most appropriate for them, not when they come to the top of a waiting list. In relation to strokes, I usually see two different types of cases. One relating to delays in either diagnosis or treatment, and the other in relation to preventing strokes in the first place, such as with mismanagement or subtherapeutic dosage of medication. If there are delays in the diagnosis and treatment of a stroke, it can have lifelong implications. Some of the therapies for stroke are time-related, therefore it's really important that the stroke is diagnosed and then treated quickly. Some of the timescales are as short as 4.5 hours in terms of thrombolysis or thrombectomy, which relates to the administration of blood thinners or an operation to remove a blood clot. So it's important that people are scanned and have a full neurological assessment as soon as they are admitted to hospital. The reason for having the FAST system, which relates to face, is the face drooping, arms, are they able to lift their arms, speech, is their speech slurred, and time's call 999, which was something which was put forward by the Public Health England, is because time really is of the essence, and it's really important that anyone who's suspected of having a stroke should be seen as a matter of urgency. One of the dangers in respect of mismanagement of prescriptions is that if the dosage isn't correct, then the benefits of that drug are nullified. For example, one of my cases related to a client whose anticoagulant medication, also known as blood thinners, had been changed from one brand to another. However, the milligram dosage hadn't been changed, but as the drug was different, it should have been increased. So it was therefore on a subtherapeutic level for a long period of time, which then led to him having a stroke as a result of a clot, which could have been prevented. After a brain injury, there are many types of therapies for rehabilitation to get people back out into the community. After a stroke, people would generally go to a stroke rehabilitation ward, but they would also require therapy once they got home. This can be in the form of neurophysiotherapists, neuropsychologists, speech and language therapists. Hydrotherapy is also beneficial for those particularly with mobility issues. We would also look at occupational therapists to help with aids and equipment, and other therapies such as music therapy or art therapy can also be really beneficial. Outside of the NHS, people can obviously obtain private therapy. There are also charities who provide really good help and therapeutic support to both the people with the injury and the families themselves. Charities such as Stroke Association, Brain Tumour Support, Headway, and here in Oxford, the Oxford Head Injury Services.